Hi, if you are watching this video, either you or someone you know is suffering from a thyroid problem. In all likelihood, this problem has been going on for a while, and you are probably frustrated with either some or all of your thyroid symptoms, or you are frustrated and possibly angry that your condition is not being handled the way you would like. If you are ever going to get control of your problem, you need the information on this video. There are exact steps you need to follow, what I call the 6 steps of thyroid recovery. These steps are: 1. Outcome. Both you and your healthcare practitioner have to have a clear idea of what your desired outcome is. 2. Getting educated. You need to have a clear idea on what your problem is and the process in handling it, and your healthcare practitioner has to have a clear understanding on how to manage this case. 3. Testing. This is the magic key that will unlock your case. Proper testing answers the million-dollar question of what is causing your problem. 4. Applying the correct solution. This is based on the results from the testing process. 5. Monitor. Monitor the progress with a clear goal in mind. Retest to see if you're on the correct course and tweak when off. 6. Live and experience life with your newfound health. My goal for you is for you to see the possibilities and give you hope that there is a solution to your problem. Pause the video, take a deep breath, sit back, relax, and hopefully you will see a roadmap for a healthy life. Before we get started, you might want to know who I am and why I am such an authority. Well, that's me, Dr. Kirshner. The picture is part of a lecture I did for thyroid sufferers. I have been helping people with these and other chronic problems for 25 years. Although I received my professional degree over 25 years ago, I am by nature a research junkie. What I mean is, my formal education was completed years ago, but most of my free time is spent on learning and applying the most current information. I have completed advanced studies in mastering the thyroid, functional medicine, and functional neurology. I could list all of my degrees, certificates, awards, which might impress you, but frankly, all the knowledge is not worth a hill of beans if you or my patients aren't getting the results that they want. What I am most proud of is all the people I've helped over the years. You see, the way most docs work is you walk into their office, you list your complaints, and after about 17 seconds, they have already decided what your problem is, and what do you think is their solution? That's right, they pull out their pad and give you a drug for each of your complaints. My approach, and frankly the smart approach, to handling these problems is from the cause side and not the effect side. What is the mechanism, or more importantly, why are you suffering with your thyroid problem? I want to dig in and find out what is the mechanism that is causing the problem. And until you fix the cause of the problem, you'll never ever fully handle the effects. Everything you see on this video and all my videos is based on the latest research and, frankly, my clinical experience. Now let's get back to your thyroid problem. You've probably gone to your doc with your list of your thyroid complaints. Symptoms like fatigue, weight gain, headaches, depression, cold hands and feet, poor immune function, digestive problem, and hair loss. He decides to order lab tests to check out your thyroid. In all likelihood, he orders a test called TSH and maybe a test called T4. Now, if this is high, he will put you on thyroid meds. This kind of care was practiced 40 years ago and hasn't changed much. Don't you think, with all the latest research and technology, this old school medicine would have changed too? Now, with the drugs, your lab tests might become normal and your doc is happy. His outcome, or what he is focusing on, is your lab tests. The problem is, you still have your list of complaints. Here's the problem. His outcome is getting your lab test normal, as if you walked into his office saying, "Fix my number." You came in feeling crappy and you feel leaving crappy, but statistically you're a success. How frustrating is that? Okay, let's give you a little education on what I call Thyroid 101. What is a thyroid and what does it do? Your thyroid gland is a gland that sits in your neck that controls the metabolism of every single cell in your body. Your heart cells, your kidney cells, your brain cells, your foot cells. In fact, every 17 minutes, all your blood is filtered through the thyroid. Yeah, it's that important. But here's the deal. The thyroid doesn't do anything on its own. Think of the thyroid like a thermostat in your house. When you want your house warmer, you turn the thermostat up. And when you want your house colder, you turn the thermostat down. The important part of this picture is you are actively changing the thermostat. Same thing happens in your body. You see, it's when the cells in your body need more or less metabolism, the cells send signals to your brain to activate the thyroid to change metabolism. When the cells of your body need more metabolism, they send signals to the brain saying, I need more hormones. But it is a specific hormone that the cells need. The main hormone the cells want is called free T3. Watch carefully and you'll see how this occurs. Okay, your brain gets the signals from the cells in your body. The part of the brain that handles this information is your hypothalamus. It is part of the brain. It releases a hormone called TRH, which is thyroid-releasing hormone. This tells the pituitary, another part of your brain, to release TSH, or thyroid-stimulating hormone. This, in turn, tells the thyroid to release thyroid hormones. The hormones the thyroid releases are basically T4 and T3. 93% is T4 and 7% is T3. Both of these are in what is referred to as the bound form. What this means is the hormones are attached to a protein to be carried through the body. What happens next is T4 is carried to the liver, where about 60% is converted to T3. Some more is carried to the intestines and converted to T3, and other tissues of the body will also convert more T4 to T3. T3 is carried through the body, where it is released, becomes free T3, and then enters the cell. The cells are happy, and they send signals back to the brain to stop making hormones. Wow, that is a lot of information. Luckily, this is on video, and you can go back and review it if you like. So, you could have a problem with the hypothalamus, the pituitary, the thyroid, conversion in the liver, conversion in the gut, that TBG or that protein, too much or too little of that protein, or something called cell resistance, where the cell is not accepting the T3. Now, the medical model will only look here at the TSH. Can you see why just looking at TSH as a marker for thyroid is incomplete? Going over the exact tests and numbers is not the purpose of this brief explanation. But I find it curious when during my seminars, when I do list the tests out, that I see people writing the numbers, like the tests and the numbers. I finally figure out why they wrote them. What some people do is take these tests and numbers and show them to their doc and ask them to run these tests. Do you really think he might have a clue what these numbers mean and how to handle them? If he did, don't you think he might have run them sooner? Okay, if that wasn't confusing enough, I need to add one very important item that needs to be addressed. You can see how anything in the whole thyroid pathway can mess you up, but there's one more thing that needs to be considered. The research shows, and I can honestly say I've seen close to this in clinical practice, is 90% of primary hypothyroidism is from a condition called Hashimoto's. This is an autoimmune disease where your body is attacking its own tissue. If this is you, then even though you might have a direct or secondary thyroid problem, the autoimmune condition needs to be addressed first. Put another way, you have an autoimmune problem, not a thyroid problem. So where does this leave us? So here you are in your lifeline. You at some point were healthy and happy. As something in your body broke down metabolically, you got worse. Month after month, year after year, your life, which should be fun and exciting, is downright miserable. You eventually seek help from your doc. He is looking at the wrong thing or giving you the wrong solution. You continue to get worse and become more hopeless and dissatisfied. The question is, where do you go from here? Going back to the 6 steps, can you see why outcome is listed as number 1? Not only do you have to have a clear picture in your mind, but the person managing your case has to have a clear idea on the desired outcome and the course of management. If it is just a lab test to get to normal, then that would be a certain path of care. If the goal or outcome is to have you live a life to the fullest, then that would dictate a different path. You now have a choice. Do you take action and start down the road to recovery, or do you continue down the path you're on? What type of person you are will lead you down one of two choices. If you're the type that thinks that your health insurance, your present doctor, and the meds you're on are responsible for your health, then your choice is clear. If, on the other hand, you want to take responsibility for your own health, get the necessary testing, and take the necessary actions, then you have another choice. Should you choose path number 2, then you need to get video number 2. On that video is a description of the necessary testing. It will explain what the tests are and why they are necessary. To get video number 2, you need to contact our office. Either fill in the contact information on this page or call our office at 610-435-1777 and ask for video number 2. I wish you a healthy life.